Phlegm dump obstructing the lung. This is due to spleen chi deficiency or chronic cough, damaging the lung, or a wind cold damp pathogen invading the lung, all of which lead to the damp phlegm to obstruct and stagnate in the lung. Clinical manifestations: cough with profuse white sticky sputum that is easy to expectorate, chest stuffiness, even asthma and wheezing, pale tongue with white greasy coating, and a slippery pulse. The key symptoms: cough with profuse white sticky sputum that is easy to expectorate. This pattern is mainly caused by the wind heat pathogen invading the body or wind cold pathogen invading the body, then transforming into heat and congesting in the lung. Cold dump pathogen, spleen deficiency, and chronic cough damaging the lung can cause the following. So cold dump pathogen, which invades the lung, will lead to failure to govern dispersing and descent, unable to spread fluids. So this will lead to collection and stagnation. Spleen deficiency will lead to failure in transportation, leading to retention of fluids. Chronic cough damaging the lungs will cause failure to disperse body fluids, leading to retention of fluids. So all this will lead to phlegm damp. Phlegm damp obstructing the lung and lung chi counterflowing upward will lead to cough with profuse white sticky sputum that is easy to expectorate. Phlegm dump obstructing the chi, then lung chi cannot move freely, will cause chest pain, asthma, and wheezing. Tongue will be pale with white greasy coating and a slippery pulse. These are symptoms of phlegm dump obstructing the lung syndrome. Let us now compare the following patterns: wind cold invading the lung, cold pathogen congesting the lung, phlegm fluids obstructing the lung, and phlegm dump obstructing the lung. Wind cold invading the lung is an excess pattern. Main symptoms are cough, white watery sputum, sneezing, and aversion to cold. Secondary symptoms include stuffy nose with clear watery discharge, fever, no sweating. Coating is thin white, pulse is floating. For cold pathogen congesting the lung, this is an excess pattern. Main symptoms: cough, dyspnea, white watery sputum. Secondary symptoms: cold body and limbs without fever. Pale tongue with white coating, pulse is slow and moderate. Phlegm fluids obstructing the lung, deficiency in the root and excess in the bronch. Main symptoms: cough, dyspnea, profuse white watery frothy sputum, splashing sounds in the chest, unable to lie down due to wheezing. Secondary symptoms: chest stuffiness, palpitations, edema in the lower limbs. Tongue is pale with white slippery coating, the pulse fine and slippery or weak and floating. For phlegm dump obstructing the lung, for excess pattern, invasion of an exterior pathogen, sudden onset, deficiency in the root and excess in the branches pattern, chronic onset. Main symptoms: cough with plentiful white sticky phlegm that is easy to expectorate. Secondary symptoms: chest stuffiness, asthma, and wheezing. Tongue is pale with thick and greasy coating, pulse slippery. To summarize, etiology of phlegm dump obstructing the lung: invasion of exterior cold, poorly expelled, overexertion and poor diet over long period, excessive consumption of greasy, cold, raw foods leading to phlegm damp obstruction by spleen settling in the lung, chronic spleen lung yang deficiency. Signs and symptoms: cough with easy expectoration of watery white sputum, aggravated by exposure to cold, aggravated by physical movement, feeling of cold, cold hands, phlegm in the throat, dizziness, feeling of fullness and oppression in chest, feeling of cold in chest. Pulse slippery and slow, tongue swollen and wet tongue, sticky white coating. Treatment principle: transform the phlegm damp, regulate waterways, descend lung chi, suppress cough. Acupuncture treatment: we use lung 5 to clear phlegm from the lungs, lung 7 to descend lung chi, Ren 17 to supplement lung qi, Ren 12 to resolve phlegm. Bladder 13 supplements lung qi, bladder 20 supplements spleen and resolves phlegm. Ren 22 to diffuse lung, transform phlegm, spleen 3 to support the spleen. Li 4 to release the exterior, lung 9 to supplement lung yin. Pericardium 6 to loosen the chest and rectify qi, stomach 36 transforms dump. Needle with even method. It is essential that a person with damp phlegm in the lung avoids consuming damp and phlegm-creating foods and beverages, especially dairy products, sweet, wheat, sugar, bananas, avocados, dried fruit, and so on. They should also avoid consuming cold refrigerated foods, foods that have not been cooked, and eating irregularly, as this will strain the spleen and can lead to the formation of dampness and phlegm. Correct body posture and exercise are important in order to avoid stagnation and blockage of the qi mechanism in the upper and middle jaw. Repeated invasions of exogenous pathogenic qi can be a contributing factor in the formation of dampness and phlegm in the lung. This means that the patient must make sure that they are suitably dressed and do not expose themselves to invasions of exogenous pathogenic qi. Beating the chest and the upper back with a loose fist or a wooden spoon will help to activate qi in the chest and thereby help to resolve stagnations of phlegm and dampness. Thank you for listening.